Hello, Pima Aryans, Aztecians. Welcome to the final chapter, chapter 14. This is the fourth video, and that's it. So, chapter 14 is infection, infectious diseases, and epidemiology. And here's all these cartoons of all these evil microbes that are out to get you, to infect you and cause disease. So the term epidemiology, ology, so it's the study of, and it refers to the study of the geographic distribution. So when and where, geographically, of disease, and then the transmission of that disease in a population. And you can get this report. It's MMWR, the Morbidity and Mortality Weekly Report. So this was from August 6th, 2010. But it gives the area, so the geographic where, so the reporting area, United States, and then you can look and you can see how the United States is broken down. So here's mountains in the United States, and here's Arizona. And then you can come across here, and you can look at these different diseases: legionellosis, Lyme disease, and malaria. You can come over here and see that in the current week, Arizona had 3 cases of legionellosis. And then it looks like we even had some malaria. So if you come over here with malaria, excuse me, I wish I had a straight edge so I could see across there. Oh, current week. If this is Arizona, we had 1 case. So anyway, if you're interested, go to the MMWR and find your state, and you can see the diseases of interest for that week. But if you are an epidemiologist, then you like to study the effect of pathogens on whole populations, not individuals. So frequency of a disease. Frequency just means how many cases of the disease per unit time. And then frequency can be broken down into incidence or prevalence. And you can see on this graph, on one y-axis, it has incidence in the thousands, and then prevalence on the other y-axis in the thousands. And then on the x-axis is the year. So if we look at the yellow line, incidence, that's the number of new cases of a disease in a given area or population during a given period of time. So the incidence in 1986 of AIDS, so that's the number of new cases of AIDS in the United States, was, I don't know, what is that? What do you think? 10,000, 12,000, because it's in the thousands, 12,000s. And then the incidence of AIDS in the United States in, let's see, what do you think that is, 1992, or 90, something like that, 92, 93, was 80,000. So that's incidence. And then a different type of frequency is prevalence. That's the total number of new cases, both old and new. So incidence is just the number of new cases of a disease in a given area or population for a given time. And prevalence is the total number of cases, both old and new, in a given area or population during a given period of time. So you can see that the the incidence, that's the number of new cases, rose from the 1980s to the 1990s, and then it went down. It spiked a little here and went down. The prevalence, that's the total number of cases both old and new, since 1986 has been steadily climbing. There's a little dip here, but then, well, this is just the estimated number of, the estimated prevalence of AIDS in the United States. So 400,000 cases. So that's old and new cases. So that's incidence and prevalence. This just shows a map of the incidence rate of shigellosis in the United States in the year 2000 by state. So incidence, remember, incidence is just the number of new cases of a disease. So in the year 2000, there were 577 new cases of shigellosis in Arizona. That causes diarrhea. And then prevalence is the total number of cases of a disease, old and new. Here's the incidence of shigellosis by month. So the previous one was shigellosis by year. Here's the incidence of shigellosis, or the number of new cases per month. So it looks like in 2000. So it looks like shigellosis kind of goes up during the winter. And then the prevalence, that's the total number of cases of shigellosis in this case, both old and new cases. And this is by age group. So if you are real young, looks like you're more susceptible than if you're older. So once you hit 10, the prevalence of shigellosis goes down. All right, so that was frequency with incidence and prevalence. This is occurrence of a disease. So the occurrence can be considered in terms of frequency, and remember frequency is incidence and prevalence. So occurrence can be considered in terms of frequency in a population and its geographic distribution. So if you are a disease and you are endemic, then you occur continuously at a stable, low level incidence rate, that's the number of new cases, within a given population or geographical area. And here's down here in the cartoon, A is an endemic disease. So just the brown, this is the normal range of the disease, and then these little dots are the number of new cases of the disease. So this would be the incidence of this disease. So this would be an endemic. So you're within a population or a geographic area. Occurrence of a disease can be sporadic, so that's when a disease occurs only rarely. And it's got a few scattered cases, doesn't have a geographic focus, so just a few scattered cases here and here. That's a sporadic occurrence of a disease. Oh, and an example of an endemic disease or infection in the Southwest is valley fever. We've all heard of that. Okay, more occurrence of disease. If you are an epidemic, so that's letter C here, if you are an epidemic, the disease has a normal range, but, because it's brown here in this cartoon, so it's got an epidemic, the disease has a normal range, but in a certain area or a certain population of people, the disease occurs at a greater frequency than usual and within a really short time span. So this would be a cartoon of epidemic. And then what we're in now, COVID-19, is a pandemic. So a pandemic is an epidemic that occurs simultaneously on more than one continent. So you can see here's an epidemic. It's just occurring here in the South American continent. in this cartoon D, a pandemic. It's occurring in the South American continent, but it's also occurring in the North American continent. And it could be on other continents as well. It just doesn't show it in this cartoon. And the examples for a pandemic are the 1918 Spanish flu and COVID-19. An epidemic, a classic epidemic, was when we saw an increase in polio cases in the United States. So here, during the 1940s and 50s, would be considered an epidemic, because in the 40s and 50s, there was polio in the United States, but it was occurring at a greater frequency than usual. Occurrence of a disease. So, a new coronavirus. So here's a kind of it's a question, but it's kind of a case study. A new coronavirus appears and is spreading rapidly. What measures might be taken by public health agencies to stop the spread? Lots of things you can do, but some of the things you could facilitate access to new vaccines. So let's get our scientists working on new vaccines. In addition to, well, facilitating access to the vaccines. I'm sorry, I said that backwards. I should have put this one first, because we want to facilitate our scientists to help them research new vaccines and new treatments. And then after that, we want to facilitate access to vaccines. So make sure that everybody has access to the vaccine. We want to be able to identify people who are infected and treat them. We want to educate the public how to protect yourself, so social distancing and masks. And then promote social distancing, and promote wearing face masks. So for every region and population, the epidemiologists have to keep good records so they can track the disease. Health departments have to require doctors to report diseases so we can keep track of the diseases. Some diseases you want to report to the CDC, not just to your local health department. Okay. From chapter 14, part 3, this is a table of classification of infectious diseases. So classification could be an acute disease, chronic, subacute, asymptomatic, latent, communicable, contagious, non-communicable, a local infection, a systemic infection, a focal infection, a primary or a secondary infection. And these are all the definitions of these terms used to classify infectious diseases. This is how you classify them. Then you can look at the different infectious diseases, and you can decide if they are an emerging infectious disease or a re-emerging infectious disease or a deliberately emerging infectious disease. So an emerging infectious disease is an infectious disease that has newly appeared in a population, or an emerging infectious disease could be an infectious disease that's been known about for some time, but all of a sudden it's rapidly increasing its incidence rate, those are the number of new cases, or it's rapidly increasing its geographic range. So then if this disease that was emerging, if it declined in incidence, so the number of new cases went down, and we all think we're safe, and then boom, comes back up, that would be a re-emerging infectious disease. And then this is kind of interesting, this one, deliberately emerging infectious disease. Come over here, anthrax and bioterrorism. would be deliberately emerging infectious diseases. Oh, and this is from September 2017, so it doesn't have COVID. It doesn't have coronavirus on it. Okay. And we just said this, but this is a different way to say what I just said on the previous slide. Infectious disease outbreaks, which previously declined in incidence, but then maybe they reappear later in time, that's a reemerging infectious disease. And then there's this initiative called the One Health Initiative that fosters a holistic approach among human, animal, and environmental health researchers to combat the emergence of infectious disease outbreaks. So check that out, the One Health Initiative, and see what you can do to combat the emergence of infectious disease outbreaks. Factors that contribute to the emergence of infectious disease outbreaks include all of these. International travel, probably even national travel, but in terms of the test, international travel. Climate change can contribute to the emergence of infectious disease outbreaks. Microorganisms evolving, so we find an antibiotic or a vaccine against a microorganism, but it evolves into a new microorganism. Just trade, just general trade, you know, I mean, that's how in the, what was it, I don't know, 12, 13, 1400s, that's how the bubonic plague was spread. The trade routes were open, and bubonic plague just wanted to participate in moving on those routes. Misuse of antibiotics. So if you overuse antibiotics, then that creates super microbes that are resistant to the antibiotics. Urban development and land use. More national parks. A war. Gosh, with war comes terrible circumstances for so many people living in, say, refuge camps. Infectious diseases spread like wildfire in those camps. And then when people like Dr. Jenny McCarthy, she's not a doctor, I'm just kidding, disrupt immunization programs. So, you know, you got to get immunized. In addition, some more factors that contribute to the emergence of infectious disease are novel pathogens or new pathogens that maybe they weren't pathogenic before, but Mother Nature decided there's too many humans, and she says, hey, you pathogen, step up and cull out the population of Homo sapiens. And then an increase in incidence of an infectious illness. So you have an infectious illness, but if you can contain it, it might not be an emerging infectious disease if you can contain it. So, but if you can't and the incidence rate increases, then that contributes to the emergence of infectious disease. Okay, epidemiological study. Descriptive epidemiology is a type of epidemiology. That's what John Snow did. He studied cholera. Cholera is an acute diarrheal disease caused by infection of the intestine, clearly, with the bacterium called Vibrio cholera. Guess what shape Vibrio cholera is? Yes, it has a Vibrio shape, so it's like a rod, but it's curved. And when you have cholera, that's characterized by rice water stools. It's gross. Anyway, John Snow, he was a physician. I think he was a physician. But anyway, he made this map, and he mapped all the cases of cholera in London in 1854. Gosh, he was an epidemiologist. He's mapping all these cases. And he found clusters of these cases, so for example here, around this pump called the Broad Street water pump. And then he suggested that the disease was being spread because the water from the Broad Street pump was contaminated. Score, and it was contaminated by sewage. So wherever this pump was getting its water, it was full of like feces and sewage. Anyway, way to go, Jon Snow. If you're an epidemiologist, basically you record location and time and cases of a disease. That's the very minimal thing you do. And then you can do all these other things. You can also be a different type of epidemiologist. You can be an analytical epidemiologist. You can be an experimental epidemiologist. But check this out. Remember Koch's postulates? You want to use Koch's postulates with experimental epidemiology, but in analytical epidemiology, using Koch's postulates would not be ethical, because if you are using Koch's postulates, that means that you are using animals for experiments with disease. And yeah, you don't want to do that, but it has been done in history to humans, unfortunately. Hospital epidemiology, nosocomial infections, now called, I believe, and you guys that are in the clinic can tell me this, nosocomial infections are now called hospital-acquired infections, or HAIs. But a nosocomial or HAI is leading to a disease. So if you have an infection and it leads to a disease, and that disease is acquired by patients or healthcare workers while they're in the healthcare facility, that's a nosocomial infection or a hospital-acquired infection. And you can get those in not just hospitals, so dental offices, nursing homes, doctors' waiting rooms. Single most effective way to reduce hospital-acquired infections? Boom, hand washing by medical and support staff. I should back up. Effective hand washing. So, and I think we all know how to do that in the time of COVID-19. So then this is remember Venn diagrams? When did you learn those? Did we learn those in grade school or junior high school when we first learned about these things called Venn diagrams? So in a Venn diagram, in the yellow circle, the presence of microorganisms in a hospital environment. The blue circle, immunocompromised patients. The pink circle, transmissions of pathogens between staff and patients and among patients. And where they all come together, that's a hospital-acquired or nosocomial infection. I'm not sure whenever the time this book was written, but hospital-acquired infections result in 90,000 deaths per year in the United States. The CDC estimates 10% of American patients acquire a nosocomial infection leading to a disease each year. Because remember, you may get infected, but it doesn't always lead to a disease. So this is an infection leading to a disease. So we talked about this. Oh, here's my guy. We talked about him previously, Ignaz Semmelweis. I have a t-shirt. My students from micro class got me a t-shirt with this guy on it because he's so awesome. Because what he did, I can't remember if I've already told you this story in a previous video, but he was in Hungary, and he was a doctor there, a physician, and he noticed that the part of the hospital where the women were giving birth, a lot of women were dying of this puerperal fever. And he saw the young doctors in training go from the cadaver room where they're cutting up dead, rotting bodies, and then they go into the maternity room and deliver babies. And he said, wow, that's not right. So why don't you young doctors wash your hands before you go into the birthing room. So if you are in the cadaver room, you leave, wash your hands, then you can go into the birthing room. Anyway, he decreased the incidence rate by like 20 times. So it went down. It was amazing. And it was, you'd think people would go, wow, this guy's genius, but they made fun of him. And then he died in an insane asylum or something because everybody thought he was crazy to tell people to wash their hands. Well, that was wrong. So, exogenous infections then are caused by pathogens acquired from the healthcare environment. As you know, hospitals are filled with sick people shedding pathogens. And then there's endogenous pathogens. Those are pathogens that arise from normal microbiota. And then there's iatrogenic infections. This is what Ignaz was trying to battle. So this is a doctor-induced infection. They're a direct result of medical procedures. So in Ignaz's day, the young docs would go from the cadaver room to the birthing room. So that was a doctor-induced or an iatrogenic infection. Nowadays, iatrogenic infections would include like the use of catheters if they're not properly inserted. Okay, more types of nosocomial infections. A superinfection, everybody's heard of this. So a new infection occurring in a patient having a pre-existing infection. And they're really difficult to treat. So check out this poor guy. He's already infected with the red virus. Now the blue virus comes in. Now he's got red and blue viruses, and they probably did some genetic DNA swapping and made this new orange virus. So now he's got red, blue, and orange viruses in here. So superinfections result from the use of antimicrobial drugs, or superinfections can result from inhibition of resident normal microbiota. Then so those are gone. Your resident microbiota are gone for some reason, and now new microbes can come in, and they could be pathogenic. Clostridium difficile, or C. diff, I know everybody's heard of that. That's transient microbe of the colon. If it becomes a superinfection, that C. diff can grow excessively, and it causes pseudomembranous colitis. And here's a colonoscope looking at pseudomembranous colitis. Ooh, boy, look at all that. Not a healthy looking colon. Aggressive control works in hospitals, and you guys know all this. Aseptic techniques, sterile procedures, isolate contagious and susceptible patients, hand washing, take a bath, handle your food in a sanitary manner, etc. But the single most effective way to reduce infections is hand washing. And that's who first figured it out, but they told him he was an idiot and he went crazy. But he was the guy who said, dudes, wash your hands. Anyway, wash your hands. We all know that in this day and age. Epidemiology and public health. You want to share data among public health organizations so we can better track diseases. You collect data by the state, you give it to the CDC, and then the CDC can give it to the World Health Organization. And we can track and tame diseases. The role of public health in interrupting disease. So public health enforces standards of cleanliness. It monitors the food supply. Milk is really a rich food, so it can cause a lot of diseases. I know, I've gotten sick from bad milk before. When you're preparing food, you should wash your hands. Yeah. You should use disinfectants on surfaces. We know that. We should use proper refrigeration, so +4 refrigeration as a bacteria static. Cook your meat. I know some people don't like that, but you probably should be cooking it thoroughly. Sexually transmitted diseases are really hard for health officials to control. The only way you can completely prevent sexually transmitted diseases, and I think they're called sexually transmitted infections now. So instead of STDs, I think they're STIs. Completely preventable with abstinence. That's the way to do it. Or it says monogamy, but that's only really, I mean, your partner could say, yeah, you're the only one, babe. We're monogamous. But, you know, maybe, hopefully, but the only sure way is abstinence, but who wants to do that? If you have a cold or flu, stay at home. Boy, we're learning that. Stay at home if you're sick. Throw your tissues away after you use them. Again, wash your hands 1,000 times.